to the community pool for a possible drowning. Upon arrival, you find an adolescent lying on the side of the pool with a bystander holding manual C-spine control. Witnesses state that the teen was seen horseplaying and accidentally dove into the shallow end of the pool, striking his head on the bottom. He was immediately pulled from the water and EMS was called. The patient is awake and alert and answers questions appropriately.
Okay, so PPE, scene is safe. I have one patient. I'm gonna go ahead and call for ALS, and C-spine is already mobilized. So general impression, I have an adolescent male laying on the ground, responsive, and was diving into the shallow end of the pool and hit his head. So then I'm going to assess airway. So can you tell me what's going on?
I dove into the pool, shallow end, hit my head.
So he's
I
alert.
can't feel my hands or
And I
my
can't feel my hands or legs.
Okay, so he's alert. Airway is patent because he's talking to me. Breathing, looking at adequate ventilation, so chest rise and fall.
Yes.
Symmetrical. Labored breathing.
Non-labored,
Non-labored breathing.
rapid and non-labored.
Okay. And then looking at circulation, so can I feel pulses?
No pulses in his radial.
Okay, carotid pulse.
Yes, carotid is rapid.
Rapid carotid pulse. Okay. And then any signs of bleeding?
He does have a little bleeding from the hematoma on the top of his head.
Okay. I'm gonna go ahead and take vitals. So blood pressure.
Is 84/48
Okay. And carotid pulse.
at 130,
Okay. Respirations
26.
and oxygen.
His O2 sat is 94% on room air.
On room air. Okay. Go ahead and throw 2 liters nasal cannula on him.
Gives it 96.
Okay. And then any temp noted.
No temp.
Okay. Then we're gonna go ahead and so symptoms are he can't feel his extremities and got a minor head wound. And then any allergies,
No allergies.
medications,
None.
past medical history.
None.
When's the last time you ate?
45 minutes ago at lunch.
And leading up to this, you were diving.
Yes.
Okay. So then I'm going to do my primary assessment, inspecting his head, feeling the back of his head, looking at his ears, see if there's any blood, and inspect
I
his.
just noted the hematoma on the top of his head with minor bleeding.
Okay. And inspecting his neck, looking at the trachea, making sure it's midline.
Non-deviated.
Okay. Any jugular vein distension.
None noted.
Okay. Then I'm going to inspect his chest, palpate it, and listen.
Lung sounds are clear and equal bilaterally.
Okay. Then looking at his abdomen and palpating it. Any pain?
No pain noted. All 4 quadrants are tender and equal.
Okay. Looking at upper and lower extremities.
Still unable to feel anything.
Okay. And
No radials noted.
pulses. Okay. Genitals intact.
Yes.
Looking at the pelvic.
Pelvic stable.
Okay. And then I would have someone help me roll him and inspect his spine and place a longboard.
In the mid-thoracic region, you notice a step off.
Okay, so we have a spinal injury, so I'm going to obviously stabilize on the longboard and continue C-spine. We're going to transport the patient rapidly and continue to reassess every 5 minutes. I've got oxygen on. We're going to leave him on the longboard in the supine position, throw a warm blanket on him, and I would call report to Brian West. I've got an adolescent male with possible spinal injury. Blood pressure was 84/48, carotid pulse of 130, respirations 26, oxygen 96% on 2 liters, with no pulses in upper and lower extremities. and we will be arriving in 5 minutes.